find out at some school grounds because they just took some pills that somebody gave them, not thinking things through. It makes it, it's really a challenge for parents to stay on top of all of that because they've taught their child. Most parents are, they've sat down and talked to their children about drugs and alcohol. Yet these are the very kids that can be taking a pill on the school ground and have absolutely no idea what it is. Co-occurring disorders. I'm in a master's program at Pepperdine right now, and I always want to put this in. This is a tough call for parents. Again, depression or some other co-occurring disorder, bipolar, depression. When this is based on Hazelden's statistics. That's one of the leading treatment centers in the United States. 62% of males, 83% of females that come in as teenagers for drug and alcohol treatment also have a co-occurring disorder. That could be depression, bipolar disorder. Those are the two biggies we get. Some ADD, ADHD, although I wouldn't personally consider that to be as an emotional disorder. I mean, that is something that, again, it's certainly not to take away from any child. We have tons of kids with ADD and ADHD. When they come into our program, their medication is switched because, again, we need to have somebody with a drug or alcohol problem on a non-addictive type medication. But again, depression, so there's always that, for me as a treatment counselor, I have to sort that out. What came first, the chicken or the egg? And I'll get to later the therapist's role in this, because again, is my child using to pull himself up if he's depressed? Or is my child's use creating depression? Is my child's use creating this bipolar type highs and lows behavior? Is that because of drug use? Or is that a co-occurring disorder on board along with it? This is a parent-parental disconnect, and again, if you get nothing out of tonight, this was another statistic that really surprised me. Most parents think that they use drugs to have fun. The real reason, 73%, is to deal with the pressures and stresses of school. 7% of parents thought that was the reason. So again, there have been a lot of cultural changes going on. My heart goes out to parents. My youngest is 27 now. And when they were in school, I had one son that graduated from UCLA, another daughter from Hastings Law School, and another son from Arizona State. There was not a remote amount of pressure on the schools, which school is your child getting into, and what you have to start doing in the middle years to prepare for that.